This is Scott Richmond
and Arnie Sherman.
You're listening to What Do You Know on Newstalk KGVO, AM 1290 and 1015 FM. Arnie Sherman, good morning to you.
Scott, how you doing?
I'm doing well.
80 more hours,
and
the election will be decided, hopefully, and we can hear about other things that are going on in the world beside emails and lawsuits and Putin and all of the static that we've been hearing for months and months and months. I'm so exhausted. Yeah, I'm so exhausted from it all. Don't you think? Don't you think the whole country wants to take a collective, deep sigh and just put all of this past them?
I do, as long as we win.
Yeah, whoever we are. Everybody has whoever the we is that they want to have win. But we are. This country is completely crazy in terms of how long this process takes.
Yeah.
We've been talking about this presidential election for 2 years or more.
Right.
I guarantee you Wednesday they'll already be speculating about who's going to be running in 4 more years.
You're right.
They're going to just move right into the next election cycle. It's crazy.
Sport.
But there are other things going on in the world beside the election. Right. And one of them that we're going to talk about today is the Zika virus pandemic. And here in Montana, we don't really feel the effect of it very much. I don't think we've had a reported case, at least in our part of the state.
What's the difference between an epidemic and a pandemic?
Well, I think, and we'll ask our guest Rick Galli today that, but I think pandemic means it cuts across the whole spectrum of countries around the world. It affects, the Zika virus is in 46 countries now.
Okay.
And in some places, like in Brazil, in the last year, they've had 1.5 million people infected, which is not, lots of people get flus and viruses, and for the typical average person that has a good immune system, they get rashes and it's like any kind of virus. But in the case of pregnant women, they've had 2,000 children born with birth defects as a result of Zika. They get microcephaly. And in the United States, there's we see a huge amount of cases in Florida and in Puerto Rico, and we're going to see more and more as the season comes in for mosquitoes.
Right.
There's and there are other infectious diseases that we almost now take for granted. For example, like HIV.
We didn't know about Zika a year and a half ago.
Well, it mutated. It was discovered in 1947 in Uganda, in the Zika forest. That's where it came out of. That's how it got its name. So it's been around for almost 70 years.
Sure.
But over time, it has morphed like a lot of infectious diseases. And we know more about it, and they've linked it more. It's related to dengue fever, and for a while it was included as part of dengue fever and some of the other tropical diseases. But as they've evaluated it further, they've seen the effect that it has. It has an effect on pregnant women mostly, but it also has other kinds of effects that they're just finding out about. And then, of course, as I alluded to, we have. There are 1.2 million people in the United States living with HIV.
Sure.
And what's most troubling is about 1 in 8 are infected and don't know it. And that's
1.5 million?
1.2 million people in the U.S. alone living with HIV. And 12% of the population, 1 out of 8, are infected with HIV.
And don't know.
No.
I was going
to
say.
We're going to talk about a little bit today with Rick Galli of bioLytical Laboratories about testing and why it's so important to test. And since 1981, when HIV was first identified, there have been 700,000 people in the U.S. that have died from it. So it's a huge issue, and we're investing $19 billion in it, and globally, just to give you just an idea, globally, to be out in the United States. Part of the reason we also invest in the rest of the world just out of humanitarian, concerns. It's almost 37 million people in the world with HIV. 1.8 million of them are kids. and 1.1 million has died from HIV/AIDS-related illnesses.
Right.
So
the fight is not over, not nearly over.
No, and it's affected a lot of families and lives. So today, I thought, as we're all have election fatigue, I thought we would talk about something in the health area, and talk about Zika, HIV, other infectious diseases, and bring on an expert, a guy named Rick Galli, who's been working in that area since 1973, since even before the HIV was first identified and AIDS was first identified. He's continued to work in the arena and works for an interesting company that's headquartered in North America and has operations here and in Canada, but they do 1 minute, 60-second tests for HIV, and now are working on a 60-second diagnostic test for Zika virus, which is phenomenal. I was reading the other day that in Florida, women who are pregnant are waiting up to 4 weeks to find out whether they have Zika. I mean, you know what kind of mental strain that is? Of course. If you're pregnant, you're worried about it. You went to Puerto Rico on your honeymoon, right? And now you're pregnant and you want to find out. You got to wait a month to get test results. They're developing a test for Zika that takes 1 minute, 60 seconds.
Incredible.
Self-test. You can test yourself even if you want to do it.
You're seeing that this whole thing of testing and looking, see what your diseases are. I watch TV and I watch CNN. You see the commercials for Cologuard or not colon, but something like that, where it's detecting colon cancer.
There's the possibility, given the new technology, that you could have a platform with multiple tests. You could test in 60 seconds for HIV, for syphilis, for gonorrhea, for dengue fever, for malaria. Right. You can test for 7, 8, 9, 10 different things, on one platform. And that's what was the company Thanos who got in trouble because they said they had a platform that could test for everything, and it turned out not to be true.
Right.
But there are platforms and there are technology, and we're going to talk to Rick about it in a minute, that are FDA approved and approved in Europe and other places around the world that can do 60-second testing and get you treated, vaccinated, or whatever very quickly. There's also implications for that for battlefield situations where somebody needs a blood transfusion very fast and you want to test the blood you're putting into someone else to see if it shows any of the markers for a great range of infectious diseases. So there's a lot of stuff going on in that area, and I thought it would be an interesting topic for our listeners to hear about it.
I think it is, and I think let's move away from politics for a little bit. Let's take a rest.
Yes,
you're right.
Where we have fatigue, and we're going to talk about something else something that's going to can affect your life in a very dramatic way.
Absolutely. So our guest will be Rick Galli, from the Chief Technology Officer from bioLytical Laboratories. You're listening to What Do You Know with Scott and Arnie on Newstalk KGVO. Back after this. Okay, Arnie, we are back with our guest, Rick Galli.
Now, Rick is Chief Science Officer, Technology Officer of bioLytical Laboratories, a North American-based company that, as I mentioned in the lead-in, has been a pioneer in rapid diagnostic testing. They have an HIV test, and they're now in the latter stages of developing a Zika virus diagnostic test. So, Rick, welcome on the show.
Thank you. Pleasure to be here.
So explain to us, tell us what your credentials are to be an expert on this and why we should believe what you tell us.
Well, I got started in the world of laboratory diagnosis of infectious diseases way back in 1973. After graduating from university, I worked for many years, 27 years, I believe it is, in public health, in the laboratory sciences area, starting out with things like syphilis, hepatitis, influenza, and other infectious diseases, and then really was integral in the emergence of HIV testing in the mid-1980s in the lab, and spent a lot of years working on the HIV prototypes that were in place at that time. Gradually progressed into some of the new science that developed largely because of HIV. For example, in molecular sciences in the 90s. And then I joined bioLytical, with that background, because I believed in a product like what bioLytical was introducing, a very rapid 60-second HIV test to, become a new tool in the box for our battle about getting control as best we can of the HIV epidemic.
So
and
why?
That's where we're at today.
Sure. So why? Tell our audience, why is it important that a diagnostic test is fast, and why are diagnostics in general important? To fight infectious disease.
Well, in using HIV as the example, we have programs aimed at finding individuals living with HIV, and that's really what diagnostics are about. You need to, if you look at the models of, the 90-90-90 program that UNAIDS has unveiled and the world has adopted, the first pillar, that first 90%, finding 90% of the individuals living with HIV, and then the second pillar would be having 90% of those on treatment, and the third pillar being 90% of those on treatment being maximally suppressed. You have this cascade, and that model can be used in other infectious diseases. The first element is diagnosing, finding individuals who may be infected so that you can introduce them into the healthcare system for treatment and anything downstream.
Why is 60 seconds or fast important in this particular case?
Well, speed of diagnosis is important because it facilitates the testing experience for healthcare providers and also for the individual being tested. In mass testing events, speed is everything. Without sacrificing, of course, the accuracy, it enables a given number of healthcare providers to test far more individuals without encumbering all the resources required to do that kind of testing with, say, slower, even 20-minute rapid tests. It can make a huge difference.
Well, I also read somewhere, and I think it is the case, that the longer it takes to get results, the less likely someone is to wait around or come back to get the results. Is that correct?
Yes, that's true. I'm sorry to jump in, but indeed, that's very true. There are reported incidents of even in a 20-minute rapid test scenario where there's that wait period for results. Individuals who are highly emotional and may have high levels of anxiety just can't take that wait period and leave before the results are actually completed. And so you lose your subject. Whereas a 60-second test, there's really no loss of direct contact between the test provider and the individual being tested.
So somebody takes it's administered in the lab, or it's administered in a clinic, or it's administered by a physician. They have a 60-second INSTI, as the test is called. They have the INSTI test, and if it shows positive, what happens then? Just to allay some folks' fear, because I know, I mentioned earlier, that about 12% of the population, at least in the United States, is walking around with HIV and they don't know it.
Yeah, so again, using HIV as an example, that first positive result is considered a presumptive positive. The standard practice is to confirm these tests with a second test. It could either be a different rapid test, or it can be sent, a blood sample can be collected from that individual and sent to a laboratory for confirmation. But at the time that presumptive positive is delivered to the subject, you have that subject there for counseling, for providing post-test counseling, and to establish that immediate linkage to the care that person's going to need, even while the confirmatory testing is being done. You have that head start to start that process.
Sure. Now, I know that the test, because it's a point-of-care test, which means it can be done even in the home, there is some controversy about whether they should be self-testing or not with HIV. What are the issues related to that?
Yeah, well, that's a good question, because self-testing in this day and age is rapidly emerging as a very viable way of reaching populations that have been hard to reach in the past. And I'm talking about not only populations that might be marginalized in Canada, the U.S., and the Western world, but in particular in sub-Saharan Africa, where standard rapid point-of-care tests have been in place for many, many years, yet still more than 50% of individuals infected with HIV have not been diagnosed in this day and age. And so self-testing is given a lot of consideration as potentially being another method to reach these populations. And early studies have shown quite a high level of success.
Right, you can reach them, but then what happens if somebody on their own finds out they test positive without having counseling available or medical personnel available to
administer it,
or to comfort them or to tell them what they ought to do about it or that sort of thing?
And that's a very key question, and that's one right now that is still needs to be determined, how that linkage can be assured in a self-testing model where individuals are testing in the privacy of their own home or in different surroundings where there's not necessarily any immediate linkage opportunities. This is something that still needs to be worked out, but there are some interesting concepts. For example, providing in the self-test kit itself with linkage information where they can contact in-country or even local representation to ensure that happens. So it is something that has to be worked out, but it's something that is being given a lot of thought and consideration.
Sure, there are lots of different things you can test for, and some have more dramatic implications than others. So, you can test for pregnancy, for example, with a self-test, and you're assuming in most cases people are happy when they find out they're pregnant, but some aren't.
Right.
But if you were testing for cancer, the dreaded C word, somebody finds out all alone that they have it, you don't know what kind of emotional impact that could have on them. Absolutely.
And then, even reverting to the complexity or the simplicity of the technology is very key. We've seen these rapid tests in infectious diseases take on a very, very simple platform that can be done by anyone with really no training, and that's very important. So I think we're just seeing the emergence of self-testing as a very real way of delivering testing, not only for HIV, but potentially for a number of other infectious diseases that we've never seen before in the past.
Sure.
At least this type of testing model.
And a question, in the United States and Canada, when someone tests or gets tested, how often is there a retest or a secondary test for confirmation?
Well, it certainly depends on the results. If a result is reactive, in most cases, depending on what you're testing for, getting a second confirmatory test is the advisable way, just to ensure that the single initial test was an accurate result. Generally, the premise is a single test result isn't always 100% accurate, but having two collaborative results is as close to 100% as you can get.
So the bioLytical INSTI HIV test is FDA approved. How reliable is? How accurate is it? For our listeners.
It's very accurate. The FDA has very, very high standards of performance that must be met. For example, terms like sensitivity and specificity, which means your ability to find all the true cases of HIV and also rule out all the cases that don't have HIV, the performance level has to be greater than 99.5% in and around that number.
So if you've done the test correctly, and it's a simple test, it's 99.5% likely that if you test positive, you have HIV.
Correct. Yeah, you have a much greater than 99% likelihood of having HIV if the test is positive, and if the test is negative, you would have an equal likelihood that HIV is not there.
So how long has this test been around, and how how has it been accepted by the marketplace, the medical community? I mean, it's very fast.
In the U.S., this test has been approved through the PMA process by the FDA since 2010. And then supplemental to that is something called CLIA waiver, which allows the test to be used by operators who are not professional. In other words, it's a measure of the simplicity of the test, and that's another process that undergoes an approval process and a review by FDA, and that was granted in 2012. And so essentially since 2012, this test has enjoyed a rising share of the market. People do appreciate the simplicity, the speed and the accuracy of this test.
And how many tests a year, NC tests, are being administered now?
Are you talking about just in the U.S.?
No, globally.
We're upwards of a couple of million tests currently. I'd have to get the
But I mean, a couple of million tests means it's being widely used.
It's being widely used. Yeah, it's being used in clinics, in community health settings, in hospitals, in corrections facilities, and virtually anywhere that point-of-care tests can be offered.
That's great. Let's switch a moment over to Zika. I want to talk about Zika because it's it's a hot topic of conversation. Well, the first thing is, I mentioned in the lead-in that Zika has been around since 1947. Has it been causing the same problem since 1947, or has the virus, morphed or mutated during that time to be more, more deadly than it had been in the past?
Well, I don't know if it's a case of the virus itself changing, but what has been changing is our understanding of the public health significance of Zika virus, and in particular with its effect on babies in pregnant moms. Really, that is the major public health concern, and as you know, and we all know, we're seeing almost every day new stories, new evidence coming out showing that Zika can cause serious public health concerns. And I think it's more that than the actual virus itself becoming something different than what it was.
And it's like Russian roulette. Not every woman that has a Zika virus is going to have a deformed or microcephaly baby, but there's a significant number. There have already been 2,000 this year in Brazil, right?
Correct. Yeah, and the CDC and others have established a definite link between Zika and microcephaly, and there's also increasing evidence that there are other complications and other defects that may be attributable to Zika virus in the mom. So there's still a lot that we need to learn, but there's enough that now puts Zika in a very high level of public health concern.
So if you test, if somebody is pregnant and they test positive for Zika, what can be done to minimize the impact on the child potential?
And that's the question. I think right now we're struggling with trying to find that answer. There are no really effective therapies. Vaccines and prevention are still a long ways away, although there's a lot of work being done. There's still no evidence that we have an effective approach to vaccine and prevention. So there's not much that can can be done other than decisions by mom.
Right,
decisions with the pregnancy.
To abort the pregnancy because of the high probability of a microencephaly affecting the baby.
Correct.
So what is bioLytical Labs' diagnostic capabilities in this area? What's going on? What are the exciting news about being able to rapidly test?
Well, based on the success that we've observed on the Insti platform that was used for the HIV test, we now believe that this platform can be adapted towards detecting evidence of Zika infection in a similar fashion. There's a little bit of complexity here in that Zika diagnosis is highly dependent on the ability to pick up a certain class of antibody that's present in the early phase of infection and differentiate it from something that may have been acquired a long time ago. And I'm talking about IgM antibody versus IgG antibody. However, we are working very actively on utilizing the successful platform that INSTI presents as a 60-second Zika test that is showing some very encouraging results so far.
You're listening to What Do You Know on Newstalk KGVO. Our guest is Rick Galli from bioLytical Laboratories.
So you have a platform, a proprietary platform that's been used for HIV and, as I understand, syphilis and HIV 1 and 2 that now can be modified and changed to use for Zika. What else could it be modified and used for?
Yes, well, that platform now is really open for us to bring into other markers. We're actively currently working on a hepatitis C, which is going to follow very similar pathway in the test and treat model that HIV is following in this day and age, for example. So we're actively working on hepatitis C detection, and there are other potential uses as the world moves towards discovery of key biomarkers for emerging infectious diseases, for example, or even cancer markers. We feel that a platform like INSTI can be adapted to work with detection of these biomarkers that may not require any amplification that molecular testing would require.
Huh. So you'll have the ability, let's assume, all things progress in the right way for the company, you'll be able to test for a whole range of blood-based infections and diseases. Is that what you're looking to do?
Yeah, that's correct. And I think even additional to that would be the capability of what we call multiplexing, where because of the design platform that INSTI presents, it allows the concept, and actually we've even done some prototyping in this field, about putting multiple markers onto the test. So with a single drop of blood, for example, you would be able to get the results of up to 4 or even 5 different disease markers that have related transmission characteristics, for example.
So you could test individuals, but you could also, in fact, test blood supply, couldn't you, with the test?
Well, in theory, yes. Blood supply has their own requirements in terms of the population. In general, the population going for blood supply are populations at very low risk for certain diseases like HIV or other sexually transmitted diseases. So the criteria for testing the blood supply may be slightly different than it is for diagnostic testing, and therefore certainly the test itself could be applied if you were to run the clinical trials necessary to test the donor population versus the population going for diagnostic testing.
Sure. Well, one of the interesting uses seems to be in the military and battlefield conditions. As we know, with the heavy body armor that soldiers now wear, there are less, less people dying and more, wounded and more wounded casualties, and they're doing more battlefield transfusions. And this would be a very cost-effective and quick tool to use in those circumstances to test blood before you made a battlefield transfusion. Is that something that's possible?
Yes, indeed. That's something we've been looking at. The military health system is very focused on something called the walking blood bank, where soldiers are matched with blood type just for that purpose, so that in the event of a direct transfusion, this is already pre-established and minimizes the time it takes for any blood matching that needs to happen so quick. So, utilizing that concept and then introducing a test that can provide an accurate result in 60 seconds theoretically, one can run this test in the time it takes to prep an IV, for example. And so, therefore, you would potentially eliminate, what might be a low risk, but nevertheless a risk of transfusing an infectious agent from, one individual to another.
Right. Well, for example, if the battlefield is in some tropical area that maybe has a history of having, dengue, if you could test for dengue fever, you would be able to, you protect the soldier, from getting it, right?
Right, indeed. And in fact, this is where multiplexing is of high interest, because one could combine related diseases like dengue, chikungunya, Zika, even malaria, under a concept of, say, febrile illnesses, diseases that cause fever that can be transmitted by mosquitoes. One can actually test for all of those with one device at the same time and get maximal, results to make that accurate decision.
Wow.
Do you have experience at all in the field actually administering these tests, or are you?
I've been in field testing situations. We work with some non-government organizations who conduct what we call mass testing events in different countries, and I've actually been part of that, not actually administering the test as a test provider, but certainly as a coordinator, with these groups, and it's remarkable to see the actual practice in real life.
I was going to say, I would imagine that would be something of real interest to you as you sit and develop these technologies, seeing them in practical use.
Right, and it really does give one a real demonstration of the practicality of a test like this. To see, I can give you an example in a testing event in sub-Saharan Africa where up to 3,000 individuals showed up in a single day, and to see, the ability of the test providers to complete testing on that number of individuals with a 60-second test. That's really the only way they could have done that.
Well, I'm too slow to do the math, but in a field situation like that, how many people in one day can a technician test?
Well, on a full day, one individual could test as many as 400 to 500 individuals.
Well, yeah.
And we actually were able to see that in reality. And what that does, even more importantly than the sheer number of individuals tested, is it gives you the potential to identify new cases, many new cases that haven't been previously diagnosed. And that's really what it's all about, and have that immediate linkage on the spot through one individual providing that test, and without the need to scale up the number of test providers.
Sure. Well, obviously, if you have a test that takes 20 minutes or 40 minutes or an hour, the amount of people that one clinician, one tester can test in a day drops dramatically. That you're down to 48 or 50 at the max, as opposed to 400.
Correct, and that's exactly what happens. So in order to achieve just the number of tests and even find those individuals that the testing is all about, in a test that takes 20 minutes, you would have to scale up your number of test providers accordingly just to reach that same number that a much smaller number of test providers would need with INSTI.
Well, let's switch gears a little bit. Tell our listeners about what happened with INSTI and Prince Harry. Everybody knows who Prince Harry is. He's dating some movie star now, apparently.
Yeah, I've seen that. I'm reading the tabloids
testing everybody before he dates them?
Yeah, that's right. He's testing everyone before he dates them.
Good man.
The entire cast of Suits probably is being tested. But to share with our audience the Prince Harry story.
Well, yeah, and this was something that no one here at bioLytical certainly was instrumental in. But Prince Harry, as we may or may not know, is very active in HIV advocacy and
like his mother was, like Princess Diane was.
Correct. Yeah, he's carrying on the legacy, and I think to prove his genuine concern and support for global programs for HIV, he actively sought out an HIV test to be done in a public setting to show that he is very willing to step forward and take this test. And he utilized one of the prominent UK programs in London that happened to be using our rapid tests as part of their standard of care process for HIV testing for everyone. And his message when he showed up and the cameras rolling was he wanted to show everyone how simple it was to have it done. And so on camera, he agreed to have the test done where the test provider basically treated him like any individual who walked through the door, gave him the full counseling, very simple messaging. He agreed to take the test, was filmed taking the test. His results were good, obviously, and he really wanted to send the message to everyone who viewed the video, and there were millions, that the test was very, very simple. And in fact, we now still get folks coming to us and say, "Oh, you guys are the ones with the Prince Harry test." And
right.
So we're now known as the Prince Harry test.
Didn't he in fact do it live on Facebook? Wasn't that how it was videoed, but he also it was a live event on Facebook.
Yeah, it was. I wasn't sure of the actual how it was aired. We were brought. It was brought to our attention through Facebook, and it quickly escalated to virtually every news wire and everything from there. So it was great. We couldn't ask for anything more illustrative of the simplicity and ease of use of this test than having someone of Prince Harry's stature doing it on live television.
Right, which is great. Our guest is Rick Galli. He is the CTO, Chief Technical Officer of bioLytical Laboratories here on Newstalk, KGVO, and What Do You Know? Rick, let's go back. Let's talk a little bit about your background. How did you, what led you to this point of working for bioLytical? Tell us a little bit about
Instead
yourself.
of playing hockey, he decided.
Right. Was there nothing ice fishing, hockey, and
curling?
No.
Yeah, exactly. No, I think really what drove me here was being a long-term worker in the world of HIV and AIDS. Really cemented my desire to stay with this program. I mean,
but was that what you wanted to do when you were in high school? When you were growing up, did you think about being a crusading, lab rat? Doing this kind
I was
of
a
stuff?
science nerd. I just knew I wanted to do something in the sciences, but I really didn't know what to expect. And maybe I wanted to be a doctor, maybe I wanted to be a vet, but who was it that said real life is what happens when you make other plans? Well,
right.
This is kind of what it was serendipitous that I ended up where I did, and I think HIV was what really galvanized my desire to stay with HIV.
Right, and you've traveled around the world going to speaking at conferences and participating in events, including ones with Elton John and others. Tell our audience a little bit, where have you gone around the world to do this stuff? Because you're
not just from Windsor.
Right.
No, it's basically where haven't I gone? I think I'm up to about 90 different countries on my various passports that I've actually gone on work with HIV and emerging infectious diseases in general, but by and large, it's mostly due to HIV.
And where are you going next? Just to give us an example.
Well, my next trip is in Kenya, Malawi, and South Africa later on this month. This is going to be centered around that self-testing concept, where there's a lot of movement taking place around introduction of self-testing programs, and so I'll be traveling there to participate in some of these early-stage developments.
And that's going to be on the HIV. When can we foresee a 60-second Zika test available for use?
Well, that's a good question. I mean, and I wish we could say it's going to be tomorrow, but it's a case of going through the process of the development side. Things are looking good. Then we need to move it into the regulatory side to allow these products to be in use, even on a fast track. We have emergency use authorization in FDA and also in World Health. So our goal is to at least, hopefully before, too much length of time here, I don't want to commit myself to a particular date, but we're working very, very hard to at least get this test in front of these emergency use authorization programs for review.
Right,
and this could take a few short months.
Right, because at this point we've had, just in this general area, we've had 28,000 cases in Puerto Rico and 4,000 cases in the U.S. And, from what you read, it's taking a long time, to get diagnostics done on these, on these patients. And we're just scratching the tip of the iceberg, obviously, compared to what we've seen in Brazil. But now it's also spreading in Southeast Asia. I look on, when you read the papers every day, there's, more cases being reported in more countries.
Indeed, and it may continue its growth. I mean, there's so many different ways that we're trying to attack this emergence. One is vector control, trying to have mosquito control, but there's very many challenges there to be effective. We're also attacking it on the vaccine level, which is still a ways off. And so we really have to have the diagnostic tools available to be able to at least identify where this is and track the effect on the population. And so this is why we have emergency use authorization programs that can hopefully fast-track some of these new diagnostics into actual clinical application.
Sure.
That's fascinating work. When we come back, we're going to have our final segment with Rick Galli from bioLytical Labs. Back after this. Okay, we are back with Rick Galli.
Rick, run me through or walk me through again the sort of the field of rapid testing. We have our 60-second test here at bioLytical. What else is out there, and how does it all fit together? I mean, rapid testing isn't new. It's the fact that you have a test that's so much faster than what else is out there, correct?
Yes, correct. I mean, in general, rapid testing would refer to a test process that you can get a result in less than an hour, and that's just a very general concept. And so there are different ways of doing this. There's lateral flow, there's immunofiltration, there's different platforms that allow this type of rapid technology to be realized. And then we have the concept of what's called point of care, where the testing can be delivered where the actual care is delivered at the same time. I'm talking about bedside testing, doctor's office testing.
Are you in drugstores, by the way? Are you in any pharmacies?
Certainly, pharmacies are really emerging as another effective way for test delivery, particularly when we talk about testing for things like HIV or sexually transmitted infections, where often patients are reluctant to go to a sexual health clinic because of fear of stigmatizing just walking through the door. But now these tests, and we actually have undergone a very successful pilot with Walgreens in the U.S., where HIV rapid testing is offered to individuals coming to the pharmacy, where they can walk in and not feel like they're being labeled.
Sure.
They can simply be going there to do what anyone would do in a pharmacy and get a 60-second HIV test at the same time.
Can you
it's worked out very well.
Can you describe to our listeners who are thinking about getting a test and how the test actually works? I know it's very visual, but try to maybe describe how it works.
The test works by simply drawing a single drop of blood from a fingertip that utilizes a lancet. This would be a single-use lancet that can't be used after it triggers. So it's a safety lancet for single use only. A small drop of blood is collected and added to a sample diluent, which is then poured into a membrane unit, followed by 2 other successive pours of pre-established reagents, all done in real time. And the results then are visually interpreted, and the entire process from collection of the blood adding it to the sample diluent and completing the test takes as little as 60 seconds, and in some cases, even less.
Yeah, that's tremendous, and it's very light and compact, and it's what do these tests sell for? I mean, how much if somebody walks into, let's say Walgreens expands it, and you walk into a Walgreens and you see a testing area, what do tests cost?
They're very cost effective when they're, if you look at, say, for an example, a cost of around $10, $12, even up to $15 for a rapid test. When you consider the cost of drawing blood from venipuncture, sending that blood to a laboratory, having the patient come back to get a result, when you factor in all of the costs involved with a laboratory test, having a point-of-care test that gives you the same level of performance and accuracy, even though on the surface it may look like those tests cost more, in fact, the cost per reportable result in a point-of-care in a rapid test is far, far less than it can cost in the laboratory.
Wow. It's actually incredible. It's going to be interesting because this type of testing and everything, it's going to become so pervasive. You're going to be able to get it at your supermarket, at your
Well, what's really important, I think, about that is given the nature of healthcare in this country, Canada, and other places, I just heard about someone who needed to get a blood test, a specialized blood test in central Michigan, and they told them they couldn't get him an appointment for 3 months.
Correct.
Really?
Yeah. So, I mean, this is look at this as an alternative. You need a blood test,
right?
And you got to wait 3 months to go to the doctor. But this, you can go and walk into a Walgreens and get a test done in 1 minute.
Right. No, it's fascinating.
Yeah, indeed, it's really changing the landscape of testing, and I think we're only beginning to see this. It's making tests more accessible. You can bring the test anywhere. There's even on campus, and there was a recent story where vending machines are being established in certain universities overseas, where people can just drop their coins or their dollars into the vending machine and pull out a self-test for HIV or other markers. And this is not far from reality everywhere.
Well, as much as we, love our families and children and relatives, we also love our pets. Can this test be used with, and potentially can be used with pets, with cats and dogs, and even farm animals, and raising livestock and test for brucellosis or anything like that?
Oh, absolutely. And in fact, these rapid tests are indeed a standard in veterinary practices, in agricultural screening, animal populations, sentinel screening, even for influenza in birds, and avian flu, that sort of thing. These types of tests can be adaptable to virtually any testing model.
So, Rick, in a couple of minutes, we don't have much time left, but how do people get a hold or want to find out more information about bioLytical Laboratories and the INSTI test? What's the web address, or how do they find you guys?
Well, certainly we're on the web, www.biolytical, that's biolytical.com, and we have a very informative website where you can see the test in action in a live video. There's information about the test itself, where it's being applied, the different countries that the test is being worked on, and also information about what's coming down the pipeline.
Terrific. You've been a very interesting and informative guest, and we look forward to seeing the other tests and products that are going to be coming out in the near future. Thank you for being with us today, Rick.
Thank you, Rick.
My pleasure.
We really do appreciate it.
It's been very enjoyable. Thank you very much.
All right, great. Arnie, I will see you next Sunday.
See you next week. Take care.
Bye-bye. Thank you for listening to What Do You Know?
I can't wait for the next show, Scott.
I'm excited too, Arnie. If you'd like to suggest a guest, send me an email at scottrichmond@townsquaremedia.com. We'll see you next week. And thanks for listening to Newstalk KGVO, AM 1290, 101.5 FM, and newstalkkgvo.com.